developing a primary prevention program for members of a rural community. Which intervention is appropriate? Encourage adherence to a routine pap smear schedule. Provide information on minimizing excessive sun exposure. Educate families on diabetes-related foot care. Organize a blood pressure screening at all local malls or at the local malls.
Okay, so what's the right answer?
I put the second one.
Which is what?
B.
Limit the sun exposure
Why? Why is that? Why is that primary?
because you're trying to prevent it.
Because you try to prevent something do not occur.
Correct. Why is the last answer secondary?
Because it's a screen.
It's a screening for blood pressure.
What's the first answer? Secondary or tertiary?
The first one
Tertiary.
was second. The first one was
What was the first answer?
Isn't it tertiary?
What is it?
secondary.
Oh, it's a pap smear, routine pap smear.
It's a
Why wouldn't
secondary.
why wouldn't that be
Oh, no, it's
secondary? Because it's
It's
a
secondary.
screening.
It's a screening.
And then why is answer C? What is answer C? Secondary or tertiary?
Tertiary.
It's
Why?
tertiary.
That's tertiary.
Tertiary.
It's,
It's
Education.
it's
They already have
educating.
diabetes.
Boom. Whoever just said they already have diabetes, that's the answer. Right? They already have diabetes and now they're trying to educate on foot care.
They don't lose their feet.
Exactly. So everybody understand that. So your answer is B, which is primary. A and D are secondary, right? Because they're screening. And then answer C is tertiary because they're helping them to manage a condition they already have. Guys get that? Okay. Third question. Go ahead, Emily. You're doing a good job.
A migrant farm worker presents to the migrant outreach clinic complaining of bilateral eye irritation, throat irritation, and cough. Which nursing intervention is appropriate? Evaluate other family members for signs of conjunctivitis. Ask the farm worker if they apply chemical pesticides at work. Request physician's orders for antihistamine. Complete tuberculosis symptom screening and questionnaire.
What's the
I
answer?
put B. B.
B?
Mhm.
Okay, tell me what B is.
It's the pesticides.
Is that everybody agreeable to that? For now, initially, remember, this is our first go at it. This is what they're presenting with. What do we know they're most at risk for? Farm worker. Pesticide exposure.
Pesticide exposure.
And what's a classic symptom of pesticide exposure?
Eye irritation.
Exactly.
Oh, you're okay.
So it's not that the other ones are not appropriate, but based on where they work and what their symptom is, B is the most appropriate answer. Right? Anybody have any issue with that? I mean, why would you jump to D? Do you need to jump to D? That's kind of intrusive, isn't it? Right off the bat?
Yeah, why this is not good?
Yeah, I mean, eye irritation is not a necessary a primary symptom of TB, so no need to jump to D, right? You try and manage the symptoms that they are presenting with, right? Okay, Emily, next one.
During a home visit, the nurse notes that a migrant farm worker's family is living in a small house with several other families. Which nursing assessment is priority?
Okay, what's the
Access
key
to-
word? Hang on, what's the key word?
Priority.
Priority. Okay, go ahead.
Access to and consumption of nutrient-dense foods. Ability to travel in town for healthcare services. History of gastroesophageal reflux disease. Tuberculosis symptom screening questionnaire.
Okay, so what's the right answer?
The last one, the TB screening.
Why?
Because they're living in a small space with other
A
families.
crowded place, so if one got it, all of them can have it.
And what's a potential classic symptom of TB screening, or why you would do TB screening.
Night sweats.
Living in crowded conditions. Right? Does everybody agree with that?
Mm-hmm.
Okay. Next.
Which statement reflects the impact of income on
Uh,
health
I
outcomes?
didn't get it.
Oh.
The answer is the TB one.
Last one, D. Go ahead, Emily.
Which statement reflects the impact of income on health outcomes? Low income guarantees access to Medicaid. High income reduces attendance to wellness visits. Low income increases the risk of chronic illness. High income does not improve health incomes or health outcomes, sorry.
Pretty easy.
C.
Which one is it?
Low
C.
income,
I'm hearing B and C.
low
Oh, I think
incomes
it's
increase the risk of chronic
C.
illness.
We just talked
Correct.
about that for the last hour. How lower incomes increase your risk for everything.
Yep.
Right? The rest of them, it's exactly the opposite. Right? Living in poverty, low income, financial instability affects everything. Everything. Okay? Really important that you guys know that. It affects everything. That's a no-brainer, right? We've been talking about that for the last hour. Okay, go ahead, Emily.
What should the nurse anticipate for a family living just above the federally defined poverty level? Increased vulnerability due to fewer community resources, improved health outcomes compared to those in poverty, reduced vulnerability due to employer-provided insurance, unchanged health outcomes compared to other income levels.
Hey, we debate this every term. What's the right answer?
Increased vulnerability.
A.
Right. So we debate this every term. So the way to think about this question is if you are right above the poverty line, I mean like right above it, you're not technically in poverty, but you have a lot of the same vulnerabilities. Does that make sense? That's the way you have to think about that question. Okay, so I'm thinking it's A. Is that the right answer? Yeah. Yeah. So you may have slightly reduced vulnerabilities, but if you're right below the poverty line, you're going to have a lot of the same vulnerabilities. Does anybody have any issue with that? Does that make sense? Okay. Okay.
Which client is at the highest risk for adverse health outcomes related to poverty? A 15-month-old infant without a medical history, a 19-year-old male with a history of asthma, a 68-year-old female with type 2 diabetes, a 44-year-old male working on a farm.
This is a tricky one. What do you guys think?
A.
Well, well, hang on. A doesn't have any kind of medical history, right?
Oh, yeah. But the
There's no
baby
medical-
needs care, right?
What?
It's a baby.
Okay, but they don't have any medical history. They don't have any risk yet. What's B?
A 19-year-old with
19-year-old.
asthma.
Okay. Yeah, they have asthma, but you don't know if they have an inhaler or not. I'm jumping to D because D is the actual correct answer. Why
Yeah,
is
D.
D the correct answer?
Because they're working on the
Wo-
farm.
Oh,
Works
yeah.
more. High
Because
risk.
they're working in a farm.
It already comes with the simple fact of the location they're working on in puts them at risk for lots of things, right? Does everybody understand why D is correct?
Yep.
Okay. The simple location of rural living or working as a migrant on a farm puts them at significant risk for many things. Okay, go ahead, Emily.
Which would the school nurse expect for an impoverished adolescent? Reduced risk for unattended pregnancy or unintended pregnancy, increased risk for dropping out of school, excellent use of adaptive coping mechanisms, improved attendance to extracurricular activities.
What's the answer? Pretty easy.
I put increased risk for dropping out of school.
That's a huge risk for the adolescent and especially the teen pregnant mom as well. Okay, is the risk for dropping out of school. And one of the things we talk about, I don't know if there's a question on the RN exam or if it's on the PN exam, but one of the things we talk about is, let's say you have a teen pregnant mom. What is the what is the priority for this mother? And all the 4 answers are correct. Make sure she has increased nutrition, make sure she gets to her visits, make sure she has a good support system. And then the other answer is make sure she stays in school. And the question is asking about priority. Okay, all those are important. But one of the biggest risks for adolescents, teen pregnant moms is to drop out of school. And the flip side of that is if you can keep them in school, either during their pregnancy or after, they and their baby have a much higher increase chance at successful outcomes if you can keep them in school. So every one of those answers is good, but it's asking for the priority. And the biggest issue is lack of education. The more education they can have, the better outcomes they'll have. Make sense? Everybody agree with that?
Yes.
Okay. Do we have one more?
We have 2 more.
So
Okay,
much.
go ahead.
Which client is at highest risk for homelessness? An adolescent with substance addiction and supportive family, a veteran with post-traumatic stress disorder living alone, an adult with schizophrenia living in a group home setting, an older child with a history of suicidal ideation. I put the veteran living alone.
I put B.
B, veteran.
Veteran living alone.
Sounds like 2 of the answers already have support systems in place, at least for now. Right? What about D? What was D again?
An older child with a history of suicidal ideations.
History of, not current, history of. Veterans are a very vulnerable population. We all know that, right?
Well, and the veterans living alone.
And they're living alone. So we need to assume they're alone. Maybe they don't have a support system. Veterans typically suffer from anxiety, depression, PTSD. So B is the right answer. Correct. Everybody agree with that? Okay.
It's new.
Okay. Next, last one.
The nurse is working in an outreach clinic at a homeless shelter. Which client would be prioritized? Complaints of night sweats and unexplained weight loss, worsening foot ulcer with purulent drainage and erythema, sorry, I think is how you say that. Frequent urination with constant hunger and thirst, difficulty sleeping at night due to panic attacks. I put complaints of night sweats and unexplained weight loss.
That's what I put too.
Okay. Anybody else have a different answer? What about the foot ulcer? It's draining.
It's not great, but I think TB with complaints of night sweats and weight loss. And it's a group homeless shelter thing. So they're living in close spaces.
I think the foot ulcer, because you think about airway breathing and circulation, and with the arrhythmia could cause that circulation to be cut off on that from that foot.
I also think with that what about infection?
Infection, sepsis.
Sepsis, infection. And remember, it's asking the priority.
That's why I put the TB, or I think would be TB, just because it's a homeless shelter, and I would think they were living in close quarters.
And that might be a good screening. But what is the priority?
What's going to kill them? That would be infection and
I would
sepsis.
say a potential infection. Not that the other three don't deserve a look. They do. But what about maybe signs and symptoms of an infection? What do you guys think?
The purulent drainage is a symptom, right, of infection?
Oh, you guys should know that from med-surg, right?
Mhm.
How did we
I'm going
do? Anybody
out of
submit
10.
yet? Did we get 10 out of 10?
8 out of 10.
8? Which one did you get
The
wrong?
last- The last question was complaints of night sweats and unexplained weight loss.
Okay.
That's what you pick.
And the question number 7 was the 15-month-old without a medical history.
I
That-
told you that.
Without a medical history. Okay. That's my
Because
bad.
they
Just
probably
because they
can't
don't have
afford
it.
for the baby to go to the doctor. So that's probably
Exactly.
why they
The
don't have a
baby
medical
don't have a
history.
voice.
That's why I thought of that too.
Okay. Well, yeah,
So
I didn't think that
maybe
far. I
the
didn't think
number
that
10
far.
was A.
Okay. I'll submit all of it. And if you end up with 8s to 10s, I'll take care of that.
I
Okay.
don't think it was
Okay.
any of the bad answers, though. I think
Yeah.
they were all-
Yeah. Okay. We'll just submit it. I'll adjust it for you. It's more important for me to go over the questions with you and talk through why we have right and wrong answers. I was reading that the 15-year-old without a history meant they were fine. But yeah, I guess you're thinking about it. They haven't been able to have access to have a history done yet. Okay. All right, now pull up your HESI prep. Okay, because we have a lot more information to add now into that last topic, into the last section of vulnerable populations. Okay, we covered a few of them last week. Let's see, today we covered homelessness, poverty, mental illness, alcohol, tobacco, other drug problems. Okay, so I'm just asking you to keep up with this. Okay. So vulnerable population section, and make sure you make a note in the rural populations to talk about pesticide exposure. Acute signs of pesticide exposure. It's on the last page. Right. Haven't covered those two sections yet. So mostly this week is vulnerable populations. So you can complete that section. You could complete, I was going to say you can complete a couple of sections of the infectious disease area, TB, but let's wait until we cover the infectious disease chapter, which is down the road. All right. But if you're keeping up with this, it's getting filled out, is it not? That's what we need. We need it to keep getting filled out. Okay, do we have any questions about today's content? Do we have a good understanding of farm workers, agricultural workers, rural population, migrant workers, homelessness, living in poverty? Do we have a good understanding of that? These are all populations that are out there in every one of you. Well, not rural if you don't live in a rural area, but at least people in poverty, homelessness, those are directly related to you right now in your own communities. Okay, poverty, migrant and farm workers and rural populations. You may not be experiencing or visualizing that now from where you live, but important to know that it's out there. I mean, how do those people get taken care of? Just because you're not exposed to a rural community doesn't mean that the population doesn't need care. Very challenging population. And I ask you to think back about, you're conducting a health fair. How do you get people there? And yeah, great, free food and transportation, all that, but do they really understand why their health is so important to keep track of in a prevention way? How do you motivate them to think that way? Versus, don't worry about it, I'm fine. Okay. Okay, helpful today?
Yes, ma'am.
I really appreciate everybody being present, being engaged, being participatory.
Yes, ma'am.
It really helps. It really does. These are tough topics to talk about, and tough populations, very, very at-risk populations, but it's part of community and public health nursing. Okay. If nobody has any questions, I'll stay on for after. Brianna, I need you to stay on for a minute, and I need somebody else to stay on. Who was it? Kendra. Where's Kendra? You on? You still there? Kendra. Brianna, stay on, and Kendra, stay on. Kendra may have already left. I'm not sure.
You want me to come back at 6, right?
Oh, yeah.
Or you want me to stay on now?
No. I have to meet with other students, Marlene. So whatever time we schedule, come back in.
In the same Zoom link, right?
Same Zoom link, yeah. I have lots of student meetings after this class.
Okay, see you at 6.
I'll see you at 6. Okay, sounds good. So that's it for me.